Hi, Dr. Tara here from the Well Family Chiropractic with my prop of a baby in my belly. I'm giving some tips on how to have comfort and prepare yourself for birthing. So one of the things that you can do to prepare yourself while you're pregnant, throughout your pregnancy, but just keep your pelvis moving, keep that open flow, fluidity of motion in your hips. You know, you can also work on your pelvic floor with Kegels. I always give advice to mamas when you're working on your Kegels. If you've never heard of Kegels, Kegels is basically working the muscles that of your pelvic floor that stop the flow of urine. So if you imagine stopping the flow of urine midway, that control those, that sphincter, you can work on that to keep your pelvic floor nice and strong so that you recover from birth quicker and you have better success with incontinence and whatnot, and just having a more supported pelvic floor. So preparing for birth is a little bit different because you don't want to just tighten. Almost imagine that you're going up an elevator as you tighten those pelvic floor muscles. When you relax them, you come down, but go into the parking garages below. So go into a couple stages below where you would normally just be relaxed. I'd really just try to have good control of those pelvic muscles because birthing happens in the lower floors. So don't just be tightening the whole way through when you're working with getting comfortable with your pelvic floors. Another thing you want to get comfortable doing, because a lot of people will opt to birth in squatting position, but really just when you're preparing to get in that position, you can prepare doing like not a partial squat, right? But also getting down all the way down, and actually with a belly in front, it's a little bit challenging, but actually getting into that position to allow you to be comfortable with birthing. Also being able to come back down into the side posture, right? So just either sitting up nice and tall, but using all your muscles. You want to maybe work on some of those opening exercises of your pelvis, of your glutes, and your low back. You want to maybe get into an opener pose. You can bring your leg up if your belly can accommodate, and just make sure you're not collapsing down on belly. You'll need to create that space. You want to have the chest openers as well. You can also get into butterfly pose, and just open up your pelvis. You can also rock your pelvis and get into some good motion. You can do that on a stability ball as well. We just want to have our pelvis ready and our body ready to birth, right? You can also get into some positions of comfort just to stretch out our bellies. So cat-cow. So that basically, you want to have a nice tabletop position, and you want to just let your belly hang and relax, and then bring it up and get into those positions. You can move around. You don't have to be stable with this. You can do some circles in this position as well. And then finally, just to give yourself some relief, if your body's aching or you just need to take a break, you can go right down into child's pose, right? Like, you can do it in different versions, getting there open. If you want to stretch out one side of your back in child's pose, you can really stretch those QLs, those muscles in your low back that get fatigued, right? You can do it this way. You can fall asleep. You can relax, but just really just moving your body, not avoiding the positions on your back where you're going to compress the blood vessels to baby, and just be cognizant of the comfort there, and your breath, and listen to your body, but also consult your chiropractor, your physiotherapist, your pelvic floor physiotherapist, your occupational therapist, all the people that work with your body, your midwives, your medical doctors, to make sure that these aren't contraindicated for you, but just finding places of being comfortable. Okay.